Rabies is an acute viral disease that causes fatal encephalomyelitis in all warm-blooded animals, including the humans. Virus is found in wild and domestic animals and is transmitted through saliva. Dogs are responsible for about 97% of human rabies. Rabies was first recognized in Egypt. Louis Pasteur in 1881 discovered rabies vaccination. 20th September each year is celebrated as World Rabies Day. Countries free of dog rabies are Canada, USA, Japan, Australia, China, Western Europe. Causative agent is Lassa virus type 1 and source of infection is saliva from rabid animals. Wild animals, particularly bats, dogs and cats, cause rabies. Small animals like mice, rat, squirrel do not cause rabies. They have not been noticed to cause rabies. See, what is the incubation period of rabies is it's highly variable. Commonly it takes 1 to 3 months and following exposure, but may vary from 7 days to many years. Incubation periods also depends upon the site of bite, severity of bite, number of wounds, amount of virus infected, species of biting animal, proximity of virus to central nervous system. More closer to the central nervous system, more the shorter the incubation period. Incubation period is shorter in bites on the face and head, neck and upper extremities, and also bites by wild animals. More the wilder animal, more the chances and shorter the incubation period. Clinical manifestations of rabies are prodromal stage, that's a non-specific stage. There is pain and paresthesia at the site of virus inoculation. Acute neurological period or stage is characterized by delirium, convulsions, muscle weakness and paralysis. Then there is spasms of swallowing muscles, leads to fear of water, hydrophobia and aerophobia, and irregular breathing is there and followed by respiratory arrest. Most of the times they result in respiratory arrest. Post exposure prophylaxis, every animal bite is suspected as a potentially rabid animal bite and treatment be started at earliest. All bites wounds should be washed, flushed at least for 15 minutes with soap and water, copious amount of water. Anti-rabies vaccine should be instituted. Rabies immunoglobulin is administered for severe category 3 exposure. Do not suture the wounds. Most of the times these wounds, especially on the face, must be sutured, but carefully there we have to put anti-rabies immunoglobulin. Whenever there is requirement of suturing of the wound, suture it loosely and put anti-rabies immunoglobulin infiltration. Antibiotics are to be instituted depending upon the severity of infection. WHO rabies exposure categories. Category 1, touching or feeding animals, animal lick on intact chicken, no exposure, no PEP to be given. Category 2, nibbling of uncovered chicken, minor scratches or abrasions without bleeding, only immunization is to be given, no immunoglobulins are given. Immunization schedule can be 0, 3, 7, 8, 28 days. Category 3, single or multiple transdermal bites or scratches, contamination of mucous membranes or broken chicken with saliva from animal licks, wash wounds, vaccinations and immunoglobulins to be given. Rabies vaccination should not be given intraglutally, but it can be given intradeltoid. Rabid immunoglobulin administration provides passive immunization and is administered only once, as soon as possible after the initiation of PEP and not beyond day 7 after the first dose of vaccine. Correctly administered rabies immunoglobulin neutralizes the virus at the wound site within a few hours. Pre-exposure vaccination may be offered to high-risk groups like laboratory staff, including the virus and infected material, clinicians and persons attending to human rabies cases, veterinarians, animal handlers, wildlife wardens, and travelers from rabies free areas to rabies endemic areas. There should be maximum public awareness, health education, and availability and accessibility of post-exposure prophylaxis. A population survey of dogs, dog vaccination, and dog population management should be there. Basically, I discussed mostly about rabies. Now at the end, I say some few words about it. Sometimes we get telephonic calls that rat has bitten a person, and mice has bitten a person, rabbit has bitten a person, and we give. That's what we should have knowledge, that rats do not cause rabies and rabbits do not cause rabies, and otherwise cats and dogs are prone to cause rabies, especially wild animals. So for these things we should have some knowledge about it. That's why I wanted to tell everything about this. At the end I want to tell that rats do not cause rabies, and the rabbits also do not cause rabies. That's why we get scared. What is the consequences of if somebody gets bitten by a rat, and we ask for go to the vaccinations. But basically rats do not cause rabies. We should have some little knowledge about it, and so that prompt action should be taken. And most of the times we forget, and we should always take appropriate steps if somebody gets bitten by any dog, by any wild animal, or rabbit dog, or any dog, or cats and bats especially. I'm sure you may have taken these things positively in the interest of knowledge and learning. Now, till next video, bye bye. God bless you all.